before I started my treatment, I was feeling very much weak.
So I first met Rogers in 2022. By that time he was on a second line ARV regimen and he wasn't doing well. His viral load was not suppressed, his CD4 count was quite low, and clinically he was weak, he struggled to walk. He had some skin problems as well, and we could see that he wasn't doing well on his treatment despite taking it. So after I reviewed his file and discussed with one of our other specialists, we decided that he is eligible for a resistance test. We did the resistance test, we looked at those results, and based on that we saw that he was eligible to change to a TLD regimen.
I was feeling very much scared because even Sibande drove with her car, and fetched my tablets at the hospital. She played a very much important role in my life. See, she used her own car to fetch my pills at the hospital and give it to me from the clinic.
So Rogers has been doing really well on his TLD regimen. Clinically he's much improved, his blood counts are all looking better. If we look at him clinically, he's much improved.
See, now I'm very much excited about the treatment. And that treatment was prescribed by Dr. Christie. That TLD, wow, I was supposed to be dead now. But that TLD prescribed by Dr. Christie changed my life. Now I'm a living legend.
He was getting irritated when he does not get his medication. So that is why it makes me to concentrate more on him, because most of the patients needs our help. And this help comes from the heart of any professional person. So that's why I intervene most in his life. That let me make sure that this patient gets his medication immediately and be cured, because everyone who's coming to the facility, he wants to receive that total care so that he can live his total life with everyone.
So I think our patient is keen to share his message with the community because he sees that people struggle with taking their treatment. Men especially, it's not easy for them to go to the clinics, but he's got a testimony of having a good experience at the clinic, taking his treatment and seeing the improvement that it brought in his life, and he wants to share that with others in his community.
My message to people is that they have to go and test in order to live. Especially men and young people, they must go to test always. Even if you are negative, you have to go and check and test so that you can know your status. Otherwise, if you don't know your status, then you're going to spread the disease if you are positive. You see, that's the advantage of testing.